One of the ways that I like to describe cognitive behavioral therapy for people is that it's like digging deeper into the glitchy processes of our brain, hitting pause, being able to replay them back, being able to zoom in and zoom out, and being able to understand what exactly could be going on from the situations and things that have impacted our life, to help us understand how our thoughts impact our feelings, our emotions, and then therefore our behaviors. Oftentimes, we don't understand this, but our life is a story of loops. That's one of the ways that your body, your brain can do things without really thinking about it. When you wake up, you don't really think about brushing your teeth because every day for the past however many days, however many years, you've woken up and you've brushed your teeth. You've gone and taken a shower. You drive to the same work every single day. You know the destination that you need to get to for your friend's house. You know it like the back of your hand. You don't even need to think about it. You don't need to consciously try and figure out what road to turn, where to go here, right, left. You have just done it so many times that it's engraved within your mind. And oftentimes that could also happen for behaviors. For example, when we get stressed about school, about work, or relationships, maybe our first go-to is to go to the fridge and eat something that makes us feel temporarily better about our situations. Maybe it's to actually engage in some form of substance use. Like, there's so many different things that happen in terms of the formula of life that we do without really considering or thinking about it. Or maybe the next time you see your friend who you waved at and they didn't wave back at you, now you have resentful thoughts. You feel guilty, you feel shameful, you want to punish them. They text you, you don't text them back. All because of some loop that played in your brain that you played over and over and over and over again. How do we get outside of these loops? How do we actually break these habits down? My name is Dr. Phil Sarpon. I'm a clinical psychologist, and in this channel, we break down all things psychology, wellness, and graduate school. Today, we're talking about cognitive behavioral therapy. Now, if you are a clinician or a student becoming a mental health therapist, you probably know all about CBT. When we talk about your thoughts, your emotions, and your behaviors, we need to talk about your body. We need to talk about where your body is carrying the stress. We need to talk about where the tension is in your neck, your shoulders, your head, your chest, your hips, your legs. We need to talk about those things too. It's really hard to then just change our thoughts, our emotions, our feelings, and our behaviors without understanding how the body plays into it. For example, if you believe that whenever you speak up in meetings, you're going to embarrass yourself, the experiment that I would say is, well, why don't you speak up just once? And so in collecting that data, we understand how to actually break apart some of those mental loops. If I tell you, okay, you believe this about yourself, let's test this belief, but also pay attention to your body. Because oftentimes the way that we might respond with embarrassment or guilt or shame when we were younger is oftentimes maybe going to be the same ways that we respond as adults. And one of the things that I think is not talked about enough is changing our body even when those things might happen. And so, yes, you can try and change your thoughts. You can try and test for and against the evidence that your brain is trying to tell you. But I also want you to change your posture. I want you to lift up your neck. I want to have you puff out your chest. I want you to kind of lower your shoulder muscles and put it back. I want you to kind of engage your core and push your belly button to your spine so that your core is engaged. I want you to sit up nice and tall. When it comes to embarrassment and guilt or any type of negative emotion, it's going to impact your thoughts, your feelings, and your emotions, but it's also going to impact your body. And the more kind you can be to your body, whether through massage therapy or chiropractic care, or exercise and movement or stretching, or just remembering the posture that you might have whenever you feel some form of shame or guilt, is going to be crucial to also reinforcing the positive thoughts, emotions, feelings, and behavior that comes with the cognitive behavioral therapy changes as well. If this video was helpful, please like and share this content, subscribe to our channel, and hopefully I will see you all in the next video.